Welcome, everyone. My name is Julie Henderson, and I am the Vice President of Philanthropy here at East Bay SPCA. We appreciate you joining us this afternoon for our 2024 Kickoff Lunch and Learn informational series. Today, we are excited to highlight our Humane Advocacy Program and the impact these services make on our community in keeping pet care accessible. It is my pleasure to introduce East Bay SPCA's President and CEO, Allison Lindquist, to start today's program.
Welcome, everybody. It's great seeing everyone here. We are very excited to have you all here, and we're looking forward to doing many more of these lunch and learns. So we hope you join us in the future.
Thank you, Allison. It's now my honor to introduce East Bay SPCA's Humane Advocacy Manager, Melissa Robinson. Melissa is passionate about improving the human-animal bond, keeping families together, and providing empathetic and supportive services to those she works with. Using wraparound case management skills, she guides clients through challenging times with their pets and uncovers the best outcome for their family. In her current role, she most enjoys developing connections with her clients and their pets. We are incredibly lucky to have Melissa as part of our team. Melissa will now run us through a 15 to 20-minute presentation, after which time she and Allison will answer questions about our humane advocacy programs. If you have questions, we encourage you to type them into the chat using the Q&A button at the bottom of your screen, and we will get to as many as possible within our time frame. Go ahead and take it over, Melissa.
All right, let me just go ahead and pull this up here for y'all. All right, well, good afternoon, everybody. As Julie mentioned, my name is Melissa, and I'm the Humane Advocacy Manager here at East Bay SPCA. I'm really excited to be here with you guys today discussing how we make pet care accessible for pet owners in our community. To best get you set up for our discussion this morning, or this afternoon, I want to give you a brief intro to myself and go over our agenda. I've been in animal welfare about 13 years now, and I have my master's in public health. I also have certifications in the human-animal bond, fear-free veterinary professionals, and adult mental health first aid. I've been at East Bay SPCA for about 3 years, managing our humane advocacy department. We're a small team. Aside from myself, there's also our HA coordinator, Sarah. As for our plan for this discussion, I'm going to take you through a few important terms that you'll hear throughout this discussion. I'll talk to you a little bit about the approach that HA takes to work with clients. We'll talk about our programs, some 2023 highlights, a sneak peek into 2024, and then, as Julie said, we'll wrap up with some questions. Our very first important term to talk about is humane advocacy. You'll also hear me refer to it as HA. HA has been around here for about 15 years now and was originally developed to support pet owners in our community. For those of you who know Oakland and know around here, there's not a lot of resources. So we wanted to do something about that. With HA, we provide a comprehensive, a collaborative, and a safe space for pet owners to come access resources for themselves. The next term here is access to vet care. And this is any work that helps to make vet care accessible and reduce barriers. On the flip side of that are the barriers, which is anything that makes it hard to get access to vet care. One example could be if somebody doesn't have a car to get to a vet appointment, what do they do? The next term here is veterinary social work. This is a field of social work that is designed to support pet owners. And with this, if the pet owner is supported, then the pet is supported. That's what we want to work towards. This goes hand in hand with the human-animal bond, which is a mutually beneficial and dynamic relationship between people and animals. It's influenced by behaviors that are considered essential to the health and well-being of both. And then we have case management. Case management is what we use throughout all of our programs here in HA. It's a collaborative process, and it's key in helping us help others. Essentially, we know that no person, no family, no pet owner, we know that every single pet owner, family, or whatnot is unique, and there isn't a one-size-fits-all approach to take care of everybody. There's a few key areas of case management that we use on a daily basis. The first is this holistic approach. This concept is, again, We're going to consider all factors related to what's going on with that pet owner at that time. I just mentioned the transportation example, but there's also examples such as what is that individual's preferred language? What does their current housing look like? Do they have the ability to take off time from work or from if they're taking care of a sick family member? How are they going to fit in vet appointments? What does their income, their finances look like? We're going to look at all of those. This goes along with individualized care, which meeting a pet owner where they are in that moment is kind of the motto here. Everybody is unique. What goes along with that is compassion and empathy. We're going to stop, we're going to listen to what's going on with that pet owner at that point in time and not pass judgment. The last piece here with case management is documentation. We document everything from the different conversations we've had with pet owners to what resources and referrals we've made for them, how we've connected with them, what pets do they have, kind of what's going on, all that relates to those factors that you see here and that I just mentioned. Aside from the case management approach, we also follow the many methodologies and usual tasks of veterinary social workers. One of my favorite examples of how we do this is when a pet is seen here through our HA program and has an appointment at the clinic, right after our doctor has finished her exam, either Sarah or myself pops right into that exam room and we are able to meet the owner, meet the pet, make that really first special connection with them, go through the clinical summary, make sure that they fully understand what happened in that exam. We can act as a liaison in case they don't really understand what happened. We can try to either help answer that, or we can loop in the medical team again and say, hey, can you help us understand this better? So we can pass it along to that pet owner. The other part of this is going through an estimate or an invoice with a pet owner and breaking down exactly what every little piece means. Not everybody can understand that certain things are pain meds or certain things are an antibiotic. We're here to kind of break that down and make things really clear, easy to understand. A part of that is, of course, looking at costs and what each thing costs and how it is related to what the pet ultimately needs, which more often than not with HA clients is surgery. Through this, we also provide a lot of education. One of the things that we educate pet parents most on are what are the benefits of spay-neuter and what sort of vaccines are out there, what is the schedule that a dog or a cat or a puppy or a kitten should get vaccines on. We can also provide education on things like how do you get a pet set up as an emotional support animal. We also can walk pet owners through making tough decisions, such as if their pet's quality of life has deteriorated and they might be facing a euthanasia decision, we can be here to walk them through that. The very last piece here that I think is really important to shout out as something that we do is we build connections. A lot of HA is about relationships, connections, matching folks with what programs and pieces are going to be most appropriate. And that we follow that all the time. Everybody has a right to vet care, and we're committed to supporting people in accessing that. Now that I've built a little bit of a foundation for you guys, I want to go ahead and go into our 5 HA programs and some highlights from 2023. The first program here is our veterinary assistance program, which is our biggest program. With our veterinary assistance program, we serve cat and dog owners in Alameda and Contra Costa County and work with them to secure veterinary care, veterinary appointments, whatever it may be related to that animal's health through this program. We're going to collaborate with the pet owner and decide whether it's best to get them in at our full service clinic here at East Bay SPCA or one of our local external veterinary clinic partners, which I'll talk about in just a moment. From A to Z, a pet owner has us on their side. We can answer questions. We can provide financial assistance through grants that we have here. We're going to connect them with whatever they need and make sure that they're cared for from beginning to end, like I said, A to Z. Now, I just mentioned this external clinic partnership. And for those of you wondering what that means is early last year, we realized that there's too many pets that need vet care And our full service clinic alone wasn't going to be able to tackle everybody. So what we did was we reached out to multiple external vet clinics in our area, meaning, again, any hospital or vet clinic that isn't ours, and said, hey, we're looking to build some partnerships, get some HA clients seen at your hospitals. Who is interested? We had a number of hospitals respond back, and you'll see a quick snapshot of them in the next slide. But this program's huge. That is why we needed to reach out to folks. In 2023 alone, we supported nearly 450 pets. And if you look, that's a huge increase from 2022, from 2021. With this expansion, nearly 100 pets were seen at an external clinic, and that was just kind of in the last half of last year. So we know that that's going to get much higher in 2024. We're really thankful for these hospitals who did partner with us last year. We are already looking into growing this in 2024 and beyond to get more pets in. Our next program that helps to make things a little bit more accessible for members in our community is our Hold for Home Crisis Boarding Program. This program is really unique and doesn't exist in many other locations in the Bay Area. What this program is designed for is to support pet owners experiencing some sort of short-term crisis, leading them to have an inability to care for their pet for a short chunk of time. Where we can step in is we will safely board that animal here at our shelter, again, for a certain amount of time while that pet owner works to get situated with whatever's going on. We served about 40 pets through this program last year, and the reasons why pets came into the program were if an owner was fleeing domestic violence and was going into a safe shelter, if a pet owner was going to be hospitalized for any reason, or if they were going to go into a detox facility or go into rehabilitation. Those were the key reasons. We also do support pet owners who are facing eviction and need someplace safe for us to hold on to their animal while they're figuring that out. With this program, I act as the pet's case manager, meaning that I'm the liaison between our amazing shelter team and the pet owner, keeping that pet owner up to date with how that animal is doing here at our shelter, facilitating visits with the owner and the pet. And on the flip side of that, I'm also making sure that the shelter team knows, like, hey, we're on board. We're going to get this animal sent home on this day, and this person's going to come visit on this day. With this program as well, you'll see the pet owner has to have a case manager themselves, helping them to stabilize that crisis, which most often, for example, can look like if an owner is fleeing domestic violence and they're in a safe shelter, they have someone who's overseeing their case that I can communicate with, rather than that person who may be in a situation where they can't talk with me. I still have a connection, and that pet owner still has a connection. Our next program is a huge program as well. This is our spay-neuter voucher program. We can provide discounted services for spaying and neutering of cats and dogs at our spay-neuter center here in Oakland. This program isn't just a discounted service. What we provide is still that case management approach. We're talking to that pet owner about what animals are in their household, who might be most at risk, and who should be spay or neutered first, what are the benefits of spay-neuter, kind of anything that goes along with it. We can also assist in having pet owners bypass that, what we call kind of normal route, where pet owners have to go on our website and log in and do all that stuff on their own. We're going to do that for them. We're going to schedule them. We're going to take their deposits. We're going to get their check-in and pickup instructions. We're going to go over all that with them. For some reference, in 2024, pets that are getting spay-neutered through this program, it's going to cost $60. Cat or dog, doesn't matter. That's a huge discount compared to what we see at our spay-neuter center, where prices range from about $170 to about $400, depending on if it's a cat, a dog, a boy, or a girl. And then that's even more so compared to these external clinics where we see charges of $500, $1,000, $1,500, give or take. In 2023, we had 318 pets spay or neutered through this program. Our next program here is our pet food pantry. We want to provide supplemental pet food to pet owners who need that. We offer two different ways that pet owners can pick up food. One is what we call our Pet Food Pantry Distribution Day event, which is an appointment-based pickup for pet owners in Alameda to be able to come down and pick up cat or dog food. The other option is our Human Food Bank Partnership Program, also a mouthful, I get that. And with this program, we go ahead and we provide dog and cat food directly to these human food banks, and then they distribute it at their pre-existing food pantries. This really means that we can access more pet owners and that pet owners have more ability to pick up food whenever they need it. This partnership only came about in the last 3 months of 2023. And in those last 3 months, we distributed those human food banks over 6,000 pounds of food, which leads us to our totals in 2023 was nearly 45,000 pounds of food. Again, we keep seeing growth and growth and growth year over year. Now on this slide, you will see a large number of animal service and health and human service agencies here. East Bay SPCA is more than a shelter, and we know that we can't do this alone. Takes a village. On here, these are groups and organizations that either we're meeting with on a regular basis to make sure that things are going smoothly, or that we can share clients and share resources and share referrals. But we're also giving that where they can send referrals to us, we can send referrals to them so that we can help pets get care much more quickly than if we were to do it alone. You also might be wondering, well, why are there health and human service agencies on here? This is because they often send referrals to us. For example, we love our partners at Lifelong Medical Care. They're providing care to folks who are experiencing homelessness, where we know many of these folks have dogs or cats. Lifelong can call or text myself and say, hey, we have Charlie here, and Charlie needs some support with his dog who's limping. How can we help? What can you do? We work with each other in that sense. The other part of this is if we know that somebody might need help accessing EBT or anything like that, again, like I said, emotional support animals, we can say, hey, we know our folks at Alameda County Health and Services Agency can help you. Again, we have to work together. Something here, I know I've kind of mentioned it already, is referrals and resources. We're not always going to be the one and only answer. So we will refer folks, we'll provide resources. We've put together a really expansive, nearly 50-page resource packet that goes over all sorts of different things and includes many of these folks in that packet because they're amazing resources. So as we look into 2024 and even beyond, HA has really big goals. You may have heard or seen by now that East Bay SPCA is celebrating our 150th anniversary this year. And with that, we really want to focus on what's going to happen this year through 2027. A part of that means that we absolutely envision a more compassionate world for people and companion animals. We want to continue to build on that human-animal bond, support folks, and make sure that they know pet care is accessible. There's a few ways that HA is really going to try to tackle this in 2024. One of the first ways is we're going to keep growing our partnerships. We want to reach more human food banks. We want to reach more vet clinics. The more options that are out there, the more options we have to serve our clients coming to us. The other part of that is we want to distribute way more pet food this year. We know that that is needed. So we want to go ahead and aim for at least 50,000 pounds of food to go out this year alone. The last big goal that we have is increasing the number of clients that we serve in our veterinary assistance and spay-neuter voucher program by at least 25%. We have really big goals, and we are really excited to help people more and more as this year and beyond comes. Really, at the end of the day, the past, the present, and the future of humane advocacy is and always has been about supporting pet owners. No matter the situation, it might be easy, it might be challenging, might be somewhere in between, pet owners can count on us. I really want to thank you all for taking the time to come today to learn about our programs. I have to finish with, if you know any vet hospitals in our area, or you might know someone who works at a human food bank that might want to partner with us, please let me know. I would be more than happy to reach out to them or vice versa, because again, that's a huge goal. We rely on folks in our community to help us. Thank you again so much. I really appreciate it.
Thank you, Melissa. That was so incredibly informative. There is no question that your programs are just doing amazing work in the community. With that, we're going to go ahead and open it up to questions. So please feel free to type any of your questions into the Q&A section at the bottom of your screen. We're going to try to get to as many as possible as we can in the allotted time frame. And we're also going to be following up with an email after this with some additional information if there's questions we can't get to. So let's go ahead with that. Let's go ahead and start. Right. Melissa and Allison, do the external partners donate to their services, or are they discounted?
That's a really great question. We are very fortunate that some of our partners, specifically with external vet clinics, do offer us a discount on services. That doesn't go across the board for everybody, but for those partners that do, we are very appreciative.
So does it benefit the SPCA vet clinic if we use them and can pay for the services, or is it better to leave the services to HA clients?
We really appreciate everyone who uses our veterinary services. For every client that pays and every person that donates, this helps fund the services for people who cannot pay. So this is a tremendous resource for us, and we do want to encourage people to use our services, not to mention that we have fabulous veterinarians, and the quality of care in our clinic is top notch. We are AAHA accredited. There are only 12% of the clinics in Canada and the United States that have this accreditation, so we are recognized for giving absolutely top quality care.
So what is the process for someone in the community to contact and request services from the SPCA?
What we prefer is for folks to email us, because that is typically a little bit quicker, but folks can also call us. Either way, our response time is about 3 to 4 days, solely because the number of requests that we get on a daily basis. It can take a little bit, but there's also a breadth of resources and information on our different programs on our website.
And in terms of each program, if someone is in need of services, what is the typical turnaround time between contact and when they are provided service?
Yeah, so like I just mentioned, it's typically about 3 to 4 days. And at that touch point, we call it triage, kind of like an emergency room. So we kind of figure out where we are. If a pet is really, really urgent, we're going to prioritize that over some other things that might just be someone looking for a referral for something. But again, typically about 3 to 4 days, sometimes quicker.
So how much money does it take to support the human advocacy programs at East Bay SPCA?
Oh boy.
A lot.
Yes. A lot.
Just the food alone, we don't get the food for the pet food pantry donated, unfortunately. So we do buy it wholesale, which is fabulous, and we appreciate the opportunity to do that. But it averages about $1 a pound for food. So we're looking at getting up to 80 or 90,000 pounds, which is $80,000 or $90,000. And having our partners in the human food banks distribute for us, it's really in their wheelhouse, and we are finding that we can more effectively distribute the food through them. They have a system for that. We also do allow pickup here, but the big chunk of the change, as you can imagine, is from the veterinary care itself. And certainly partnering with the outside clinics is very expensive, but really critical. And we're grateful for these partnerships. I mean, the discount that they can give us is truly appreciated, but we're going to see this expense grow significantly. As Melissa indicated, we are committed to growing this program at least 25% this year and look for further growth in the future.
So can you remind us, Melissa, of the definition of HA and BWS, the acronyms, and what they mean?
Absolutely. So HA is Humane Advocacy, which is the department that I manage that has those 5 key programs. HA was created about 15 years ago now to help pet owners in our community as we do have very limited resources out here. So we wanted to find a way to support folks. VSW is veterinary social work, which is a subset of social work designed to support pet owners specifically in improving their life to thereby improve the life of their pet.
So is this benefit only available to residents of the East Bay?
Right now, our programs are designed for Alameda and Contra Costa County, but I do also meet with folks across the state, across the nation, and I even have some connections in Canada where we meet and chat about programs. We provide advice to one another. So our services are only provided here, but our expansion definitely goes further than that.
And does East Bay SPCA have a relationship with Alameda County Community Food Bank?
We do. They were actually the ones that kind of helped us get this Human Food Bank partnership set up.
And are there ways in which volunteers can help the HA programs?
There are definitely. We have kind of a varying amount of resources, or excuse me, of positions and whatnot. And folks can go on our website and get signed up for volunteer onboarding and learn a little bit more about that.
And stay tuned. We're hoping that we can provide a broader breadth of foster homes for our Hold for Home program. We are seeing a tremendous need, as everyone can imagine, with what's going on in not just the Bay Area, but nationally with people coming into crisis. We're going to be looking for more volunteers that perhaps will be willing to take and own animals as fosters, and that will help us tremendously increase the bandwidth of this program.
So what types of vet services are provided through the veterinary assistance program? Like, for example, would an ultrasound be provided at a reduced price or no fee? Like, does it depend on the animal? Just a little bit more information on that.
Yeah, that's an excellent question. And we rely very heavily on our amazing veterinarians, whether at our full service clinic or at our external clinic partners, to talk us through what the pet needs, what they're recommending. And much of what we support depends on what that recommendation is. And I will say that our program is really designed for kind of those urgent cases, at least with veterinary assistance. So we do serve a lot of things where animals may be hit by a car, or maybe have a broken leg, or even maybe they ate something that they should have. Those are more of kind of what we fund. But we talk to everybody. We use that case management approach really to guide what we are able to fund and not.
So what kind of outreach do you do to get the word out about the services that your programs are providing?
I love that question. If you remember that slide with all of those logos, we rely really heavily on our partners to make sure that folks know about our programs. We're also very fortunate with an amazing website that has a lot of info on it that we can easily send out to folks. But word of mouth is huge. So if you know somebody who might benefit from these services, let them know. The more people that know, the more people we can serve.
Great. And how often do you have pet food pantry distribution days?
We hold these distribution days right now once a month. But again, with that amazing Human Food Bank partnership program, there is food going out into the community several times a week.
That's great. And do you have the ability to help or get help for more urgent case clients who can't afford ER clinics, like a GI foreign body or something a little bit more emergent?
Oh, usually no. Sometimes yes. Again, it all kind of depends. And we hope one day to maybe be able to expand that to support more with those emergency visits. But it is tricky.
And I know our Hold for Home program is a little in flux, but there is a question is if there's a time limit for Hold for Home pets?
Yes. So with our Hold for Home animals, we want to make sure that their quality of life is still good. So because of that, we do place a limit on how long the animals can stay with us, bearing in mind we want their behavior and medical needs to be met most appropriately. More often than not, the maximum is about 30 days, and that can vary again based on how well the animal is doing, since most of them do stay in our shelter setting here.
And have you seen an impact in demand because of home insurance exclusions of certain dog breeds and other reasons related to housing?
We don't ask that specifically, so I can't provide a really good answer to that, unfortunately. I'm sorry.
Do Santa Clara or San Francisco County shelters have similar programs to East Bay SPCA's Humane Advocacy programs?
I do know that there are some programs that are similar across the Bay, and I'm certain there are some things that are kind of like ours, but we are very unique in the breadth of how we offer things and the different programs that we provide.
It looks like that's our questions, unless there's anyone else has more that they'd like to elaborate on. Wait a minute. Well, please feel free to follow up with either Melissa or myself directly if there is additional information that we can provide. Both of our email addresses will be in the follow-up message, and they were also in the original messages that went out as you registered. And I'd just like to thank Melissa and Allison today for leading, for Melissa for leading the presentation and Allison for being here to help answer questions. And on behalf of all of us at East Bay SPCA, I'd like to thank you all for joining us today. We make these programs possible through supporters like you. And if you're interested in ways you can help, including volunteering or donating to these services, please don't hesitate to reach out to me anytime. We're always grateful for your support. Have a lovely afternoon, and we hope you'll join us again soon for a lunch.